Well, hello everyone. My name is Dr. Jeff Blank, and I want to thank you all for taking the time to join me tonight. We're going to be talking about creating surface morphology, texture, and final luster for anterior direct composite restorations. First off, I want to thank Premier Dental Products Company for inviting me to speak. I've been working with Premier Products for a long time, and if you're like me, sometimes it's easy as we work through, do our jobs to sometimes not pay a whole lot of attention to the things that we're using, and it really is pretty easy to simply look around in your drawers at any given point and realize that Premier makes a large range of products that pretty much cover the entire domain of dentistry, and it's really been a significant privilege working with them, particularly on some of the products that I've been working with lately in creating surface morphology, texture, and luster. Again, I'm Dr. Jeff Blank. I am a full-time private practitioner. I'm just south of Charlotte, North Carolina, about 18 miles in a town called Fort Mill, South Carolina. This, of course, is my office. You'll see my website down at the bottom and, of course, my email address. On the last slide, I'll be posting those again, so if you have any questions, of course, feel free to go ahead and email me, or certainly you'll be able to type some in now. If we could reserve the majority of them towards the end, it probably will allow me to stay on time, which I am notoriously, something that I notoriously struggle with webinars, particularly when it comes to lecturing. I have been lecturing for a long time. This is basically probably about my 14th or 15th year. I've lectured pretty much all over the world at any given point. And through probably by osmosis more than design, I really have developed a penchant for enjoying doing direct composite restorations. I would say I predominantly do more porcelain in my practice, but we're going to be talking about some of the benefits, and I'll go ahead and say right as we get started is that, direct composites have their place in dentistry. And, obviously one of the issues associated with direct composites is they propose a number of challenges and opportunities to us as dentists and for patients. But there is something that literally is magnificent about being able to increase our patients' access to aesthetic procedures, primarily due to cost. Obviously, there are a lot of patients out there that want to enhance their smiles. However, when it comes to doing porcelain restorations, it can be outside of their economic capabilities of doing so, and being able to broaden or expand your ability to please patients very much, like you'll see in some of these pictures that I'll show you here. You can enhance their aesthetics very simply. You can do it conservatively. You can do it affordably, and fewer appointments. The benefits literally go on and on. Obviously I've been doing these a while. When I first began lecturing, particularly on doing direct composite restorations, my primary focus was largely in developing color, incisal edge translucency, and over the years I've developed two particular types of layering techniques. I have to say, with some degree of apology, that we're not going to be able to talk about layering and the layering techniques, although they'll be shown in some of the slides. So if you could, if you'll bear with me, we'll have to stay focused largely on creating surface morphology and texture, and we're going to have to assume some basics here. That everybody more or less understands outline form, but as we move forward, really what we're looking at is being able to enhance the quality of life for patients that particularly certainly every case I've shown you here, with maybe the exception of that diastema closure, would benefit from porcelain. However, particularly in this case, this young lady is a 911 operator. She's single. She's not making a whole lot of money, and she really wanted to enhance her smile. I always like to make the joke that if you do direct veneers on patients, sometimes it'll dye their hair blonde, as you can see in the before and after pictures. But again, it is certainly fantastic as a clinician to be able to, not only be responsible for the aesthetic results, which we always are, but actually to create them with your own hands. That's certainly something that I enjoy a lot. But the challenges, of course, is that we have to not only restore beauty, form, and function, we have to really go back to some of the basics, and a lot of that really centers around dealing with morphology and surface texture and those kinds of concepts. And I deliberately showed these particular pictures, and if we had time, we could go back and review all the errors in the morphology of some of these teeth, particularly in surface morphology. You know, as you begin doing this, you're going to realize that you're going to spend a great deal of time really trying to get outline form. You'll then begin working with layering. And it's only after years of me trying to master those, and I certainly don't consider myself a master by any standards, you know, you begin to look at more subtle intricacies, and that's what we're going to be focused on today. So our course objectives are going to be, of course, to discuss the key morphological characteristics of natural anterior teeth. We're also going to demonstrate techniques and materials that will expeditiously, and that's one of the things that you're going to find if you've attended any of my lectures in the past, is that I'm not one of these people that really have the time or patience or inclination to spend hours on teeth trying to create these restorations. And I'm going to be targeting certain morphological characteristics that I think are important, primarily for day-to-day dentistry, which I believe even somebody farther along the curve than I am might find to be beneficial, and you can certainly add to and become more intricate if you'd like. And we're going to talk about methods of creating surface texture and final luster. And I think we all realize that, you know, that the process of creating luster can be a process of removing composite, which could be a process of removing some of the morphology that we actually made. So what we're going to try to do is focus on these three particular items for the remainder of our time together. Now, before we begin, we have to almost have to apologize for the fact that there are just inherent issues associated with teaching morphology. First off, we all went to different dental schools. And certainly, you know, while the commonalities are expected, there are a lot of different approaches to doing so. And having done countless hands-on programs with creating particularly direct composite veneers, I certainly do empathize with those that I've certainly seen in classes in person in the past that really look back at, you know, morphology as being one of the most dreaded, loathed classes in dental school, and sometimes for obvious reasons based on our teachers and instructors. The focus, you know, particularly in dental school, is not necessarily to teach art. It really is to teach function and form, and it's only as we get out into practice and begin to want to expand our aesthetic capabilities that we really begin to focus on, you know, some of the intricacies that would be more or less the artwork behind the science of actually creating these restorations. We also have other inherent issues in, you know, the textbooks that are being used. Different schools, different textbooks. Some of these, and I'll go ahead and say this is the one that I was actually taught with. I have it sitting in right here in my office. And one of the issues with it is it's pretty basic. It's fairly crude. Now, as you look along at some of these more advanced textbooks, and some of these I do advocate and have looked at, you know, none of them are wrong per se, but they're just different interpretations. You're looking at what anyone would consider an art form, and basically I'm going to have to choose, if you will, one particular art form in which I'm going to teach. Now, you may or may not be familiar with this company. If you're a lab tech, you probably would be, but this is PCT Dental. It's a professional training corporation, and they're out of Morgan Hill, California. I've got a great deal of experience with them, and I have to say, as I get started, I'm going to be using a lot of the images from their teaching materials. However, their teaching materials are largely geared towards lab technicians. They have a very sophisticated method of not only an institute there in Morgan Hill, which I'm very familiar with. I'm certainly good friends with some of the people that work there, and had the privilege, and I'll show you in just a minute, of spending a good deal of time with their founder. But as you can see, and if you'll write that website down, you know, lab techs get all the glory sometimes when it comes to aesthetics, and it just certainly makes sense to potentially look at their approach to how they view making these fine pieces of art that they charge us so much for, and then adapting that to your own style or you know, basically your own capabilities, because we're not all born artists, obviously. But in this picture, just to give credit and also respect to the late Dr. John Ness, he was actually the founder of PTC, has been in my office a couple of times, and his son and other people that you see there in the lower right, along with my lab technician. If you know anything about Williams Dental Lab and Bobby Clark, that's him on the left. Actually, their facility is not far from Williams Dental Lab, which is obviously just literally a couple of miles down the road. But just to give credit to where credit is due and thank them again for allowing me to use some of their work. I do appreciate everything PTC has offered for me over the past, say, 5-6 years. I love to put this slide in all my lectures. You know, we can talk about morphology, but certainly one of the biggest problems we have in aesthetic dentistry is that we have to see the forest through the trees. I think we're trained to be tooth technicians. We tend to look for holes and look at individual teeth. However, we all know that the so-called forest, when it comes to aesthetic dentistry, is going to be the basic aesthetic composition. And, you know, I would love to sit and spend a lot of time in my full-day program. Certainly I do, but there are several kinds, and I've just listed 4: bold, soft, dominant, and feminine aesthetic compositions. And to say that there's one type of central incisor or a certain type of anatomy with one particular, say, number 8, it's not always going to have the same anatomy and from mouth to mouth, nor is any smile going to be the same from any patient to patient. And, you know, but we have to remember that we can get morphology, we can get layering, which I teach a lot of, down, but if we miss these basics of the so-called basic aesthetic composition components, such as smile line or axial inclination, probably one of the bigger overlooked ones that I see, certainly even in published literature, is gingival crest and heights of gingival tissue, and maintaining interdental papilla. That can be particularly troublesome for us as dentists, regardless of what we do and how we manage the tissue in the process of doing our restorations. So I've been corrected. It's PCC. I'm saying PTC. It's PCT. I'm sorry. I did misspeak myself. I had someone correct me, but I apologize. But yes, it is PTC. Proximal contacts. I think everybody also knows buccal corridor is going to be important. And let me turn the sound off since I'm getting an email while I'm talking to you. All these things, gingival embrasures, incisal embrasures, and we'll talk a little bit about incisal embrasures. That's going to fall in our domain today. But if you miss the forest, obviously the trees somewhat become irrelevant. Well, the trees, of course, are the actual morphology of anterior teeth, and one of the good things about, I guess, anyone that does any kind of lecturing is we take a lot of pictures, and pretty much just by proxy we just end up with an entire litany of having what we call a natural tooth library. And, you know, nothing that you see here looks surprising. It's the types of things that we see every day. What really ends up being the difference sometimes is that we have to sit back and actually pay particular attention to what we're looking at. And what, in fact, it creates a tooth, a canine looking like a canine, a lateral incisor making it look like a lateral incisor. And, you know, again, we could go on for days, and this is a half-day program trying to cram into a 1-hour webinar. But, you know, what I'm going to do is basically, you know, talk about what I consider key morphological characteristics that are common within all teeth. We talk a lot about surface texture, well, particularly towards the end. And, you know, we can define that in a number of different ways, depending on the book or whoever is doing the actual program may define this and choose to give it other titles, but common sense would say there are some teeth that are basically highly polished and almost dome-like. Those are going to be your low morphologically textured morphology and textured teeth. The moderate is really where we're going to be focusing today. That's going to probably be the most common. As you see down at the bottom, high, it's going to be a real coarse texture, particularly the tooth, you know, there on the left here. Not very many patients are going to desire this as their aesthetic outcome. I would imagine a lot of people would like to have that corrected. However, the one on the right would be considered a highly textured tooth, a very obviously attractive tooth. And, you know, these demands really probably more represent the fact that we may be asked to duplicate, you know, if someone comes in and fractures the corner off of this tooth, we're going to have to be able to duplicate this texture, and the same so on for the other ones as well. So there are different types of surface texture out there, but really what we have to realize that regardless of surface texture or morphology, it is the details of the details of the surface morphology are in fact important, but the visual result of any type of surface texture or morphology is manifested by light reflection. And I really want to pause and not necessarily repeat that, but just emphasize the fact that, you know, I'm an in-the-trench dentist. You know, I can miss and have missed the actual morphology more times than I've probably hit it in my career. But, you know, towards the end, we're going to talk about how if we can manage light reflection, the reflective zones that come off the tooth, that's really what is going to give that tooth the realistic pop, particularly if you're photographing it and having to show it to thousands of your peers. The challenge becomes how to actually manage the light reflective zones. And, you know, the other third and last important thing before we embark would be that, you know, common sense says you can either enhance or destroy this light reflected components in your morphology in the process of finishing and polishing. And, you know, it's easy. I think we are all trained. There was a saying when I was in dental school, if you can't make it right, make it bright. And maybe some of you might get a giggle out of that, but with gold, I think that was kind of something that we all learned to try to do. We'll just get it real shiny regardless of whether we have the morphology correct or in a crown or something like that. But our goal is not always to make something bright. You know, if we back up to this slide, as you can see, if you look in the so-called moderate zone here, you wouldn't find these highly reflective surfaces at all. And again, here, what you're seeing, just notice that you know, particularly with the flash to take the picture, you're looking at light reflective zones. A good portion of the tooth technically has maybe even a medium luster. So if I'm able to kind of just draw your attention to those three basic concepts right there, I think that'll kind of set the stage for how we're going to move forward. You know, key morphological features of anterior teeth, again, we have to pick some. And I have chose to pick some that may be grossly familiar and others not. One of the things I find when I teach, you know, any type of morphology in class, you know, if I'm doing a hands-on program or lecture, is very often we remain confused about even some of the terminology. This particular model from PTC, I'm sorry, is a huge model that you can buy one of every tooth in the mouth if you care to do so. But I like to show these in teaching. One, they're exaggerated morphological characteristics. However, they're not so exaggerated that they don't look like teeth. And if you can kind of get the vision of where we're headed with this, you can see that teeth, if you look at teeth from different angles, and that's why models like this, particularly large models like this, are important, is that you can begin to recognize things that maybe we'd often overlook even with our loupes as we're looking into the mouth. Different perspectives, we rarely get to see teeth from this perspective unless they're, you know, on the end of a forceps somewhere. But there are a lot of undulating rolls and different components that I'm going to be emphasizing, and we'll kind of use this as the marker as to the type of morphology that we want to create. So if I were to pick, you know, 4 different components that I would consider the key morphological features of anterior teeth, the first would be what we call the primary plane. If that's not a familiar term to you, it will be by the end of the program. And I will say this, one second. Some water. But what I will say is, even, you know, the terminology of what in fact the primary plane is, how it's labeled, is not necessarily as important as the fact that it is going to be probably the single most dominant element in refining morphology, and it will always be the place that I would recommend for you to start. So don't pass over it if you're not familiar with it. It wasn't used in your textbooks in school. Most people realize that anterior teeth have 3 developmental lobes. Sometimes we overemphasize these 3 developmental lobes. We're going to show that the lobes themselves particularly are not necessarily as important as the so-called transitional line angles, which are going to be the reflective zones that you see on top of particularly the mesial and distal lobes of the front teeth, and then only on the mesial lobe of the canines, as you can see it's outlined in this picture. In developmental grooves, you know, one kind of a saying that I tell my assistants when they're making anterior temporaries is, you know, if those that are skilled know the top 3, the unskilled assistant, you can pretty quickly teach them how to create some anterior grooves in anterior provisional, and it really will make the difference. It'll almost set the stage for, you know, giving the illusion of some of the other features that are obviously more important. So when we talk about primary plane, you know, obviously it's an often overlooked feature of maxillary incisors. You only find it in the maxillary incisors, not in the mandibular or any of the canine teeth for that matter. Even though they're often overlooked, they actually control the appearance of nearly every other morphological feature, and therefore I place primary, you know, authority on the primary plane. They are distinct undulating depressions, and you can more or less get a mental picture of these here. You know, obviously we can draw this particular shape, and I think if you stare at this long enough, you're going to realize that you know it's immediately this depression here is going to actually minimize, if we talk about the 3 developmental lobes, it's going to minimize the actual appearance of that lobe, but it's going to create this depression that we like to see from an incisal view, and I'll show you some of the importance of how that influences the other morphological characteristics as well. But if you look at the primary plane, obviously it needs to be aligned with the actual long axis of the tooth. So, you know, if we're going to create or develop these, whether we're going to choose to sculpt them or actually carve them in secondarily after final curing, the width of these primary planes can actually determine, if you will, the width of the, not necessarily the developmental lobes, the mesial and distal developmental lobes, but really the transitional line angles. And it is the actual width of this plane that largely has the biggest factor into making a tooth appear larger, wider or narrower than it actually is. That'll be emphasized later with the transitional line angles, but understand they need to be aligned with the long axis of the tooth. Get a mental picture for the actual outline of this, and it'll make more sense for you as we move along. Developmental lobes, we're all taught this. Textbooks are pretty common to teach the 3 developmental lobes. I think if I had to say one of the biggest mistakes that I see made when people are creating composite restorations is they tend to make them like football fields. And for those that don't know that a football field is created for drainage, at least an outdoor field is, they're not these crested domes. However, if we overemphasize this middle of the 3 lobes, they typically end up looking like primary teeth, and sometimes that's obviously advantageous, but most often it is not. So the primary plane is going to obscure that middle lobe a fair amount. And yes, in fact, the lobe is there, but it does become obscured. When we're talking about developmental lobes, I would say obviously now that the mesial and distal developmental lobes are going to be the most dominant. And one of the most important things when we're dealing with creating, if we're doing multiple restorations, is that we want to have lobe symmetry. And that lobe symmetry would obviously be symmetrical as you go from each contralateral tooth, both mesial and distal. And it is certainly acceptable, as we saw in the last slide, I'll show you in another slide, I'm sorry, to actually alter those lengths on purpose. If you have diastemas in certain areas, you may want to actually modify those to give the illusion of symmetry when in fact the teeth aren't symmetrical at all. But getting to my point about the middle developmental lobe, it is primarily obscured by this primary plane. And as you can see, just looking at a facial view with a slight tilt towards, obviously, towards the floor here, you're going to be able to see more or less a concavity in particularly the gingival 1/3, and it is this primary plane that actually is obscuring. You'll be able to see the actual middle developmental lobe towards the incisal edge, but it's down in the crest of this that the primary plane largely obscures that middle developmental lobe. The transitional line angles, what they are is obviously one of the most important visually distinguishable morphological characteristics of teeth. If you look at the picture that you see on the left, it's just a frontal view photograph of a natural smile. You really don't see a whole lot of tooth morphology if you want to get technical about it. What you're largely seeing is the reflective zones that are largely present at the so-called zenith. As you can see here, these are vertical light reflective zones along the zenith or of the mesial and distal lobes. And I think because there is technically no zenith on the middle developmental lobe is why we see so much emphasis on the mesial and distal. But as you can see from the central incisors, and this is just from a frontal view, you're going to see the mesial and distal transitional line angles, typically on lateral incisors and both canines. The thing that you're going to be aiming for is to create really mesial transitional line angles, and the distal is obviously going to be present on the lateral incisors, but not nearly as important. As I say, they are there, and one of the things that you'll see with transitional line angles is more than the developmental lobes themselves, those reflective zones, at least visually, are going to actually frame the tooth, give it a sense of width. and where they're placed and how they're rolled into the actual gingival tissues in the interproximal zone really will make a huge difference in defining outline form. You could have similar teeth of similar outline, but then of course alter actually the reflective zones as they approach the gingival tissues, and then certainly realize that you can make a tooth look more ovoid when in fact it's square. These are just manipulative tricks. Many of us, I'm sure this is review for a lot of us, but the other issue that is important, and it's more so important than actually defining where the grooves are, the developmental grooves or the actual developmental lobes, is where you place the actual reflective line angle. In other words, the zenith or the highest crestal point of polish on these mesial and distal lobes, or the so-called transitional line angles. Obviously, if you keep them farther apart, a tooth can appear wider, whereas if you choose to move them inwards, these reflective zones actually define what would be the facial flat surface, if you will, of the teeth, can give you the illusion of a tooth being fat or actually being much more narrow than in fact it really is. On incisors particularly, the mesial line angle is obviously going to be shorter and more acute, and the distal line angle is obviously going to be longer, sweeping, and more obtuse. And you can develop or play with these based on what your target is to create different outline forms. Obviously, the teeth being shown here are more ovoid teeth. This is going to be more pronounced in ovoid teeth, but in square rectangular teeth, you may see very little dissimilarity between the mesial and distal line angles. The developmental grooves is probably one of the easiest. One of the things that I would admonish when creating, if you're doing particularly an entire smile associated with creating a smile out of direct veneers, is that whereas it's easy to put in a developmental groove, unless you're in one of the so-called masculine robust aesthetic compositions, very few people would actually find it attractive to have deep ridges or very sharp distinct grooves. I tend to call them more valleys, and they're valleys that largely, I believe, should be made up of non-reflective zones. In other words, creating almost a shadow, if you will, rather than actual having distinct, groove development as we see here. But again, I jokingly said, if you really want a quick trick to try to make a tooth look more like a tooth, particularly if you're training young, new assistants, this is kind of one of those first go-to things that I say, this is easy to do, and where to place them can be certainly passed down pretty quickly. So as we talked about those key morphological characteristics, what we now have to talk about, obviously, is how to replicate them. And we want to be able to do this effectively, and we obviously want to be able to do it efficiently. We're going to begin with a pretty large Class 4 case, pretty big whack. This case, I wish I could develop this case in full, but the patient had existing composite restorations. I had to mock the tooth up for the emergency basis, and then the patient was brought back, obviously, to correct the defects altogether. I think clearly the patient could have benefited from crowns. However, these are the only restorations in the patient's mouth. She had a small diastema that was closed by composite, and it was one of those things where the composites were durable until she literally took a tumble into an end table or something of that nature and just split her lip, and it was kind of a pretty bad scene. But so we got her stabilized, and we're going to kind of take that case from here. There are a couple of different ways. Layering, I wish I could spend more time on it. I've developed two techniques. The histological layering technique is certainly the most complicated of the two. It involves, obviously, a lot more intricate detail in developing actual zones of translucency and grades of color. The second one that I've developed, which was actually the first that I published and did some IADR research on, is what I've grown to call just CBLE. It's a pretty simplified name, and it's an acronym, and it stands for Cut, Back, Etch, Bond, and Layer. It met with a certain degree of criticism back in the early new millennium, and since, I see it replicated from time to time, but we're going to be using that here primarily because our focus is not layering today. Our focus is going to be finishing and polishing, and that'll make a lot more sense, and I'll be defining that technique as we go. If we're going to work on any kind of direct anterior composite veneer, large class 4s, we obviously have to maintain an optimal working feel. There are numerous ways to do that. The old cotton roll concept, I think, is probably going to work against you if you're going to stick or hold tight to that. I've received criticism, and I duly take it, for not routinely using a ligated rubber dam for all my direct procedures, and I think maybe it's because maybe I'm going blind, or maybe I just need to, I lose perspective. But if you've ever worked with a rubber dam and doing restorations like these, the benefits are tremendous in terms of fluid and crevicular fluid control and bleeding and gingival protection and having an optimum working feel. However, I've taken the rubber dam off several times and had a midline be off, or missed the color altogether, or there's just a number of other things that I find that, you know, retraction is good. I can give my patients breaks, and there are a number of them out there. They're clinical photographic cheek retractors. We use 2 in our office. This is my preferable one with the actual metal bow here. All of these can be ordered from a variety of photographic companies like Photomed, or you can get Smart Practice, I believe, sells a good number of these. Patterson, I know, sells these, and Benco and Shine. You may not be familiar with Optrogate. We have another name for this. I don't think it's appropriate to repeat what we call it here in the office. However, it does actually have a firm frame on it which can be inserted in the mouth, and it works very well. But really, it's going to be the Comfort View retractors by Premier that we'll be talking about. And the reason why I prefer them is that they really have some optimal features, not the least of which are going to be these actual bumpers that you see here that move the actual frame of the lip away from the actual teeth themselves. Pretty much all the other retractors will sit right on the gums, cause a constant irritation, particularly in longer procedures, and I think that's going to be the most optimal thing. As it states here, maximum visibility, ideal for short and long procedures, and we find ourselves using them almost routinely when we're not using a rubber dam in the posterior area, and I'll show you some tricks for that in a second. But, you know, the key thing is it's easy to place, it's autoclavable, latex-free, all the things that you really want to avoid. But if you take a poll in my practice, certainly Comfort is going to be, it's well named as Comfort View. You can see well, and it's very comfortable to use. If you're going to use any retractor, I think, you know, you certainly don't want to get a bunch of Vaseline all over your teeth while you're trying to do bonding procedures, but just a light coat of it or chapstick is certainly recommended. Irritation, saliva pools in these areas, and if you're doing longer cases, and since we photograph and film a good bit of ours, that becomes an issue. Their placement, I'm going to show you a video of how it's placed. We fumble a little on the video, but you know, really the concept is you squeeze them, you insert into one side, and then with a little bit of guidance, you basically slip it into the obviously the opposing side of the oral vestibule, and then allow the bumpers to slide under the lips and then seat into place. And I'll show you a pretty quick video of how easy this can be. You know, obviously here we're just applying just a little thin coat of Vaseline. If I had to say a mistake, she's holding it with her right hand. I think if she had begun holding it with her left hand. The problem is that when you go to manipulate these, and you know, I think we all don't want to look stupid, and it's easy to look silly putting any of these in. You want to be able to slip them in, you know, conveniently and easy. You just really need to practice, you know, even with the photographic cheek retractors. But as you can see, the lips and tissues are way up off of the actual work surface, and that really pretty much puts you in an ideal position to be able to use these. I talked about posterior applications with Comfort View. You may or may not be familiar with these Neo Dries, as you see down here from Microcopy. Delon actually makes something called Dry Tips. I think they're similar and relatively competitive in cost. These are more or less the equivalent of diapers, if you will. You will have a diaper explosion if you leave them in the mouth, very much as you put a kid in a diaper in a pool. What ends up being the case is they you know, absorb water, and the actual absorbent pellets will break like an exploded diaper. These are actually called dry aids. These are just cardboard, and they're a little more flexible. They're not quite as sharp. But the combination of using, if you see over here on the right, of using the Comfort View to really retract, we will place these neo-dries. Just sometimes this shows it outside. It's easier to put it sometimes under the actual extension that goes in here, holds it in place better. But sometimes we'll use a cotton roll, not use a cotton roll. But if we're not using a rubber dam, if I'm doing a crown prep, this is an excellent, what we call a tongue guard. It keeps the patient from, trying to assist you in prepping the tooth by moving the handpiece around with their tongue, which certainly is advantageous. In terms of maintaining a feel, the combination of these things, even in the most difficult patient, and by the way, I didn't mention 2 different colors, 2 different sizes. The light blue is going to be the smaller. This is obviously the gray is going to be the larger of the 2. But again, it's the magic of these bumpers that really make this an operating perfection here. I think this is the same video. I want to make sure I don't have something out of place here. Okay, yeah. All right. The other thing that we use a good deal of, and again, this is another premier product. Everybody is familiar with Mylar. Well, Mylar has its advantages. We also have, and you'll see in my publications over the years, using this DenMat dead soft foil. One of the key things in bonding is you want to etch and bond and do your adhesive procedure without getting any kind of etching and bonding on the adjacent tooth. That strategy is obviously there, for good reason. We typically used to like the dead soft foil because it had no memory. I could press it against the teeth and it wouldn't stick straight out and get in our way. I think Premier's got a stellar product by putting a stop, and that's why they call it stop strips, where you can choose, and you'll see it throughout the rest of the lecture, this combination of being able to pull it through and then obviously isolating from this direction. And it really depends on what you're trying to do and what you're trying to isolate. But that stop certainly makes a significant difference and makes things very easy. And again, it's not a layering class. This is going to be that Siebel technique, but this is the etching process. And we're going to actually be creating some incisal edge translucency, and we're going to do this very similar to the lab. They will often use body porcelain, create it to full contour, and then come through here and actually cut back what we so-called dentin mamelons down in the bottom, and you're going to see us do that here. So I've built the teeth out of a dentin body composite material, and now I'm using obviously a medium grit Premier composite finishing diamond to come through and actually create the so-called dentin mamelons. We always joke we're going to let the patient walk out and look like they have a steak knife for a smile. But again, this is in the dentin body layer, and these class 4s, I will go ahead and extend. You'll see that I'll extend the dentin body material up into the well beyond the actual fracture zone, and I'm going to cover the entire tooth with enamel. You get increased surface area when you do that. It's also easier to visually control the final result when you have full domain. And whereas you could make an argument maybe on tooth number 9 that I didn't need to do that, certainly tooth number 8 almost warranted a crown. So certainly not worried about I'm not preparing that area, I'm just covering it. Preliminary and proximal finishing, you have a number of choices. I go for thin and flexible. Everybody's familiar with diamond strips, but the Premier Composite strips obviously have a gateway in the center that's uncoated. Comes in 3 grits and 2 widths, which is fairly typical in the industry, but probably one of the best things if you've worked with a number of the different brands that are out there is that there's little to no memory. You can basically almost tie these things in a knot and they don't become wrinkled and curled. Very often some of these very expensive diamond strips can easily look like you're trying to curl a ribbon on a Christmas present after using it one time. I would say that's probably one of the bigger selling features of these. However, when I do get into some of the finer interproximal finishing, I do prefer the Epitex by GC. It's just a very thin material, and this is something you could actually pass through a contact. By design, any of the diamond strips are going to be thicker, probably would destroy a contact if you use them injudiciously. And when you get into some of the actual mylar-backed sanding strips, they're not nearly as productive or aggressive, and can be kept somewhat thinner, and your ability to polish even within the contact, given the various grits that are available out there. Everybody, of course, is familiar with 3M's product. It's been around forever and was probably put in your hands and dental school, but again, another good part of the armamentarium that we'd want to deal with. I probably am going to take you back to that video in just a minute as we get going here. I realize I did pass a video, but we'll see if we have time. I'll back up to it, really just showing the armamentarium. But managing bleeding, you know, in this particular case, I developed teeth to full contour. We made this cutback. I find myself working in approximately with burrs and things like that, and you know, I don't know whether it's because of getting older or I've always been a gorilla, but eventually I'm going to nick something and something's going to bleed that I don't want it to bleed. The advantage of a rubber dam obviously would be ideal. I've made my comments on that, but being able to actually control hemostasis in terms of the operative procedure, what you're going to find is that you're going to have to rely on some sort of hemostatic agent. And one of your biggest concerns, obviously, is going to be one that it has to work, and two, that it's not going to actually negatively affect your bond, and you definitely don't want it to stain the tooth or have any kind of residual staining down the road. With Traxident, one of the nicest things, and probably everybody's fairly familiar with some of the competitive products out there, it's going to be a far more affordable alternative to some of the other materials that are available. But I'll give you, I'm going to show you this technique, but you know, the key things that in the video we'll be able to look at really the ideal features of this. But this material can be syringed. It comes out easily. There's no complicated syringe to use it. And the application method, it's obviously an aluminum chloride Hemident type containing material from the company that makes Hemident. But you know, being able to do it and do it correctly is obviously going to be the biggest factor. So I'm going to show you a video on its application. And as you can see, the material syringe is very much like that of a flowable syringe rather than anything complicated. You don't want to jam or shove this thing up underneath the actual sulcus. You just want to apply it more or less along the sulcus itself and allow it to pass. And compared to Exposil, which we'll talk about in just a minute, you're really going to have this material be able to flow much more easily underneath the gum line just by nature of its viscosity. Your key is to let it stand for 2 minutes, and they make some caps that, you know, particularly for posterior teeth. But you're going to see excellent hemostasis, washes off very cleanly, and really is probably by far the easiest dispensing medium. Now, you've got certainly other options which include cord and Hemident and other areas, and you can certainly do that. I just try to avoid going under the gum line like the plague preoperatively, in other words, packing cord. I've created trauma packing cord as much as I've stopped it. But other available materials that are on the market are Viscostat Clear, and their Viscostat comes in two forms. If you're familiar with the Ultradent product, the plain Viscostat is a ferric chloride material, which is an iron-containing material. It really works. I mean, it's super duper works, but the problem is that you can get residual iron deposits in your tooth, and if you've used it before and had teeth appear, your restorations, particularly off-ceramic grounds, appear to mildew over time, and that's probably the best term, is what you're getting is actual iron deposits you failed to wash them away. I really couldn't advocate that in direct bonding at all. The Viscostat Clear is an aluminum chloride material, and basically I don't think it works nearly as well. And the whole premise, and if you've ever seen any of the videos or worked with this product yourself, you have to buy this Dento infuser that you see here, and the whole premise is that you need to be scrubbing it into the actual capillaries, and the scrubbing method alone can actually end up creating bleeding in and of itself, so there's some trauma associated with that. Exposil, it remains a good seller. I think everybody that uses it somewhat despises it in the sense that you do depend on it a good bit. However, it's grotesquely expensive, and even though they've tried to improve the gun, there are a lot of accoutrements of 3 different parts you have to assemble, keeping them assembled, and then the ability to wash it away is far more difficult than what you saw, obviously, with the other product. But just to move along, and we do need to move along here, we're going to be applying the enamel layer, and we're using the Siebel technique, but it's the etch. We've etched the material, and that's all we're doing is cleaning it, and obviously at best etching the non-covered surface so far. Going to be rinsed, it's going to be bonded, and then we're going to layer or apply our enamel material and the enamel viscosity and shade that we've selected. But instrument selection is going to be key. Obviously, if we're looking at our choices out there, we have numerous ones. I have recently begun using an instrument called Slicks, composite instruments from Premier. In the past I've used and still believe are good instruments, the Hugh Freedy Satin Mini line, and that Hugh Freedy Gofogel CCIB instrument is one that I've used a great deal as well. But the advantages of the Slicks instruments is one, they call it the big easy handle, and if you have any fellow snow skiers out there, I'm 50 years old and I cut my teeth, so to speak, skiing, working with, super long, ultra thin skis, and by the time I guess you get older and fatter, you just realize that, shorter and fatter is better for skiing. My hands seem to adapt and do well with these bigger handled instruments. I certainly enjoy that aspect of it. They come in, a number of different styles and selections, and pretty much if you have a favorite out there, really there's no doubt you're going to find a compatible instrument in these Slicks instruments. Some of them are dual-sided, meaning having the same type of end on each end. Others have different sides for one end of the instrument does one thing and one end does the other. And they have a selection of anterior and posterior instruments. And it really is kind of hard not to find something that you would find to be ultra convenient in applying material. Now I'm going to show you a video of actually applying the enamel layer. We're going to walk through a couple of slides, so I'm going to move kind of quickly. But the key thing is you want to begin with an adequate mass. You're going to want to sweep this material towards the incisal. And, one thing I want, everybody probably knows the term, you don't want to be going pat, pat, pat or hearing tink, tink, tink. We hear so much complaints that composite materials have a lot of porosity in it, when in fact it's the instrument that we've chosen that actually creates the opacity. Well, there are some bad composites out there. The majority of them that by the bigger name companies obviously are not going to be laden with all kinds of porosity inherent in the syringe. It's the way we apply it and the instrument that we use that actually creates the porosity and the problem. As I begin to lay in this enamel layer, I will back up and say you really need to bring an adequate mass. Adding more later is probably the most frustrating thing that you can do in creating this morphology. So I call it, taking a pretty good chunk to the hole, so to speak, and then having room to manipulate the material. And as you can see, what I'll do is if I find I have just a gross excess, I call it milking, but I'll be pushing the material towards the incisal edge and just kind of scraping it off. But it's going to be imperative that if we've created these mamelons to get this enamel material adapted in those areas, and you'll see in the video as well. Could spend all day talking about your choices. These Optra Sculpt instruments, I use them from time to time. They're pretty handy, but they can be equally as sticky, and they spin and move. But sometimes it's a mood, and I end up using them, sometimes not. If you're not familiar with the Lube Cube by Centrix over here on the right, I think all of us use an alcohol prep or something. We want to lubricate our instruments. I'll tell you right off the bat, if you're having to lubricate your instrument, you're using the wrong instrument, and hence the advantage of the actual finish that you see on the Slicks instruments created by Premier. But they are effective. They have a little sticky thing where you can stick it right here on your glove, and even you're bound to get excess on here, and you can have your assistant wipe off the excess, but if she's using a 2x2, typically you're going to get lint on it, and just getting trash and other buildup and sludge on your instruments it's pretty nice to be able to wipe it off. And there's a little bit of just basic, unfilled resin inside of those that's just about the right amount to where you're not, creating soup. You want to use the Slick Mini IPC. This is going to be my favorite for creating outline form, defining obviously the midline. And again, I wish I could teach a lot about outline form, but I need to move along. But I'm going to, and these are the things that I sculpt, and then I'll show you the things that I actually carve in. But the primary plane is going to be sculpt, and I love this. I call it a duck horn or an acorn end type instrument. This is the same case, by the way, that I've been showing you. These are stills from the video that I take, and for some reason they appear like the teeth are longer. Still, I haven't figured that one out yet. This was new with this lecture, but I think the format that I did the video, actually, when I tried to make them in a square slide, made them look a little longer, but it is the same case. But as you can see, I'm going to create this outline form, and I'll move this along and kind of show you where I'm going, because you're going to see it in the video in just a second on how we actually sculpt it. But again, the primary plane being the primary focus, and again, you know, you're going to see that it's going to, you do see the middle developmental lobe, but a lot of the primary plane will obscure it here. As you see, we're trying to copy here, and we want to begin developing these transitional line angles. And the transitional line angles, as we said, on the mesial is going to be more acute and shorter, whereas on the distal here, we're going to see it's going to be more broad and sweeping depending on the type of the shape or form of the tooth. And that same IPC instrument can be used to develop those actual slopes that you see in natural teeth. And certainly I'll show you that in this video if you'll watch this along with me. And I'm clicking it, but it's not playing. Let's see. Thank you. And Trung, it's not playing. Can you get that to play? That's actually a good one. We want to watch it. Close the drawer tools. Aha, thank you. There we go. I had some tools open that wouldn't let you see it. My apologies. That's what happened with the last one. Now, one thing I'll say, and this is a testimony to the instrument, not that I'm trying to, you know, make it seem like it's, you know, the best thing since sliced bread, but it's pretty darn close. Do you see that the material is not sticking to the instrument? I can use a buttering motion, if you will. And I'll actually back this up here if I can actually stop and maybe click here. And I don't know that I can do that. But, you know, as you can see, I was actually spreading or pushing the material. Very often as I'm applying it, I'll apply it up into the gingival 1/3 and begin actually so-called milking it. Then I'll grab this acorn-shaped slicks instrument and begin sculpting the primary plane. And when I talk about the primary plane, it's obviously in this shape in here, like this. And if this is the primary plane, we're also creating, by creating a primary plane, we're creating the mesial lobe and the distal lobe, but we're also trying to move this reflective line angle, or the transitional line angle, and a lot of that is accomplished, obviously, with this particular instrument. So we'll continue the video. And, you know, it looks like I'm doing things backwards, and, you know, I'm looking at it from the side and the forward direction, but I was able to apply, you know, the actual material pretty close to right outline form, and I was using that instrument really to just shape the edges. And you see here now using the IPC to kind of move in and create the actual planes, the transitional line angles, and the actual developmental lobes. And again, I wish I could show you the full video, but I've got to obviously move along to stay on time here. But in terms of sculpting, this is really all I try to sculpt. You know, you can go to some of the masters, and I know I've attended courses with Newton Fall and Vanini and several others, and had to share the stage with them. And, you know, I've just had to admit to myself that I don't have the time, patience, or inclination to maybe go as far as sculpting, you know, uncured composite to any great degree. But if I had to say what my primary focus is, the focus would be that I want to create obviously the primary plane. Inherent in that is going to be the mesial and distal lobes, with the obviously mesial being the most dominant and facially prominent of the two. And I'm going to try to use that duck horn to actually move the reflective line angles. But as you can see, you know, this basically is what I end up with. And if I end up with that, I feel like I'm really in great shape to be able to move forward and begin actually using the various sanding discs and materials to actually refine or shape. So obviously the processes are repeated. I will stop and answer some of these questions. One of which got my attention is what kind of composite. This particular composite is a mixture. It's the majority of the composite, and the final layers associated with it were going to be Filtex Supreme Ultra, and I really like that particular product. It's probably one of the #1 selling products out there. I like it for its handling. There are a number of other products out there that I like. Aesthetics HD is one that I use a great deal. ideal. Very easy to use system. I could go on and on, but this one, to answer your question, is going to be Filtech. So we get to the latter part of this, is creating the final luster or polish. And they've fortunately given me a little more time here, and I do appreciate it. Creating this final luster or polish, this is where we're going to really kind of get down to brass tacks, so to speak, and be able to create the morphology of those five different components that I taught and said that we're going to be targeting. But the first thing we're going to do is, and we're going to get our terms, not necessarily correct, but I'd like to get our terms in line. We have contouring, we have finishing, and we have polishing. Contouring is definitely a gross movement, and it's largely going to be done with burrs. Now, there are a number of different burrs that are out there. Here you see I'm using, I guess because I've done so much crown and bridge over the years, I just have a better hand with diamond finishing burrs. Premier makes, they'll create a block for you that basically will meet whatever demand that you want. And you'll see that with the majority of the companies out there. To buy a stock block, for instance, you can certainly buy this particular block, but you're going to want to add or change, and certainly the Premier rep will be more than happy to meet with you and dial one in perfectly for you to make sure that you have what you feel like are going to be your go-to type diamonds. As you can see here on the right, these are Comet burrs, and I've worked with them a good bit. And if I had to say, if I were to use a carbide, I'd probably default to using these so-called Q finishers down here. They're very unique, and that's what's being shown here. One of the problems I've had with the traditional so-called Brasler ET burrs is that it's not the burr, it's the guy holding the burr, is that I tend to nick and grab, and I just really have never, I didn't do well with them in school, and I've never done well with them in practice. The Q finishers are certainly some of the better carbides. They only come in two different grits, but they're fairly unique in shape. They're selling features, but just about any company, including Premier, can create a block with whatever you want in terms of diamonds in different grits and polishes, and certainly I would advocate sitting down with your Premier rep and being able to create a block that's ideal. But as you can see, I used a long medium grit burr to create my outline form. Our next statement that we want to create that kind of pops out, of course, is going to be obviously the primary plane. I will actually draw it very much like this. I use a mechanical pencil, draw directly on the tooth, and try to outline exactly where I want to do that. Sometimes my drawings aren't so good, but remember our targets are that we want the lobes to be pretty much symmetrical in width, and as you can see in my drawing here, I kind of fell into a little groove, and that tends to happen, but the target remains the same. As you want symmetry in the lobes, you really want this to kind of, the primary plane, to influence the actual separation of the two mesial and distal lobes. And you can try to sculpt, and I certainly advocate doing so to the degree that I showed you with that Duckhorn Slicks instrument. However, it's probably just as easier to have a fairly flat anatomical form and then cut it in with whatever selected burrs that you would choose to use, and I would choose to use diamonds. I'm going to show you some video of this as well. Of course, the first thing was primary plane, so I created the primary plane. I told you I sculpted primary. Now I'm going in and using a burr to refine that. And, I do need to back up. When you're using these burrs, it is nice to have an electric handpiece where you can alter the speed. If you're trying to do this at 200,000 or 300,000 RPMs, it's pretty easy to make a mess of it. I tend to knock this down to a 1-to-1 ratio and run this thing probably, roughly anywhere from 50,000 to 100,000 RPMs, depending on how coarse my diamond is, and that could be a nice little pro for those with electric handpieces. The second thing I'm going to do is refine the transitional line angles, and we'll see a video of this. And as a matter of fact, I think let me see if the video's next. And then the developmental grooves, I'll back up. But really, you want to go in and develop. As we remember, we have the actual mesial and distal lobes, but we really want the crest of the transitional line angle is going to be that reflective zone, as you can see, that would run along the top or the crest of these. And you're going to actually begin manipulating those, of course, with the diamonds. And then the grooves are going to be obviously very easy, so let's just jump to the video and make sure that we're actually controlling. Oh, I'm sorry. I thought the video was next, but I'll back up. I know I'm jumping around, and I apologize. To regroup, obviously, we're going to talk about mesial distal lobes, creating the actual reflective zone, which is the transitional line angle. We're going to create mesial distal developmental grooves, which I mentioned earlier. I don't care much for deep grooves, but I prefer more of valleys, if you will, and I would call them these areas of non-reflective zones. And so what you're seeing in this particular picture here is that you're actually creating developmental grooves. You've got your anatomy in here. It's just not polished, of course, but depending on how willing you are to work with the various grits of diamonds, you could actually accomplish a lot of it that way, but I don't know that's necessarily the most expeditious way to create this type of primary anatomy. So we get into finishing and polishing, and finishing and polishing is where we've got our anatomy defined, and then we're going to come in and obviously want to begin polishing the area. The worst thing we can do right now is pick up a big silicone cup and just start obliterating everything. So you got several choices, and you're going to have to use a combination of polishing discs, cups, and points. I'm considered somewhat the poster boy for caulks and Hans. I'm on a lot of their ads. I've been quoted as stating if they took it off the market, I'd quit dentistry. It really is an amazing tool. You can use it, but you need to realize it is not a polisher. It is a finisher, and it is quite capable of obliterating just about every bit of your anatomy that you have. However, if you lack anatomy and you want to create subtle valleys and stuff, that could be particularly good. Pogo, on the other hand, is a high shiner, and is designed to create a luster or polish. And then these other systems are systems I use fairly randomly in mixtures. When I'm working with like Filtech, any of these so-called nanofill materials are going to polish like microfills. Using microfill polishing systems is certainly advantageous. I showed these three because you're going to see a difference in size of the points primarily, and the effectiveness of those points. Sometimes you want a broader point, as you would see down here in the Venus system or the Optifine, and other times the smaller cup is good. I really love the edge and how well it's maintained. I could go on and talk about the benefits of those if we had more time, and certainly we're running out of it. But finishing, and the old saying, nothing's done, no job's complete until the paperwork's done. Sandpaper discs, basically, and they're no longer paper, they're backed with polyfilms. There are millions, not millions of them out there, but several very good products that are out there. By default, the Softflex system, they now make it in the Softflex XT, which is their thin variety. I think most people are using those now. Very effective, lots of full range of four grits that can several different sizes. Obviously an advantage, but the primary disadvantage you're going to see between the Cosmodent and particularly Softflex compared to a product that has been made by Premier called the Poly Pro is that these are so-called safe center. They don't have the actual metal grommet in there, and for those that are familiar with using these types of products, one, they tend to spin more on the mandrel, depending on your mandrel. They also end up nicking and marring your actual composite. And although the shapes and sizes are fairly uniform between both the Cosmodent and here, you're really going to find that you're going to have better choices of shapes and sizes when it comes to the actual PolyPro system. The defining features are, one, they're safe-centered. Two, the way they lock onto the mandrel, that you typically don't get as much spinning. That would just be my personal preference. But, they're thin, they're flexible, and the size and shape, as you can see, particularly as you get into the finer finishing ones, these smaller ones really are ideal for interproximal and incisal type finishing and polishing. But you're going to begin with the black at coarse, and you certainly don't be running these things at 40,000 RPMs on your Midwest Shorty, or you will destroy everything. But as you can see, pictures are worth 1,000 words. You can easily see that you're looking at being able to approximate and define your anatomy. And as you can see here, I'm polishing the actual transitional line angles. So the black is going to be the most aggressive, and you can see I'm beginning to actually move that outline form, but move the reflective angles. You can use push and pull motions on the ones that have dual backings, and you can actually begin moving your transitional line angle to where you want to be. But you really typically are going to have to go through all of the grits. The larger sizes you're going to see in the video in just a second really is probably going to be just for buffing the top crest And then what will happen is that as you use your sandpaper to really do most of the defining and get most of your shine, and more or less limit, if you will, the actual point use cups, that sort of thing, to polishing the internal valleys and areas where just basically sandpaper can't go. And again, you want to go through various grits, but this ends up being something that I really like to see here. I love to see these transitional line angles kind of start to pop out. You can see it again here. And what will happen very often is I may not choose to want to keep this V shape that we see here, and I would use pick the sandpaper up and kind of buff that out. And again, the options are endless, but you'll want to choose a high shine material. You can do this with sandpaper dish. You'll see it in the video. You can use something like Pogo and just buff the top edges. You're not really trying to buff out anything. You're really just trying to hit the reflective zones and not create any kind of, giant, baby bottom kind of thing. But if you needed to create rough surface texture, pretty much all those steps are almost all eliminated. A highly textured surface, as you see here on the left, is obviously going to require, and there's very little high gloss to this, so you're going to use medium to coarse diamonds to create that texture, refine that texture with finer diamonds, and then you're really going to take it from this particular point of being pretty rough and jump almost immediately to the higher gloss shining material.